to our one more session on YouTube and Instagram both. People have already joined into. I think there were some cases left. There were some cases to be shared on the WhatsApp, and I had to answer those questions. I have basically shared one of the case today of China. Do read that case on the WhatsApp. It was an interesting case from my OPD diaries. And if you are following me on the OPD diaries or YouTube or Instagram, you must be seeing that I basically post cases which are very simple, and whatever that has happened in the OPD during the conversation of the patient, I just share that. So it becomes easy to understand. And once you rubricate those cases, sometimes some unusual and some infrequently used remedy comes, and when that gives reliefs, it really gives a good feeling that these remedies are also important in life. So there are few other, there are other rare or infrequently used remedies, I would say, which has given me good results. Infrequently used remedies. So there were a lot of queries of how to like for example, I had used Aristolochia clematis for a gynecologist complaint, and there were a lot of queries that how from where to read these remedies and how to apply. So I will be planning a series on infrequent use remedies on Instagram or YouTube, and I'll be sharing some of my clinical experience of these remedies. Of course, symptomatically there are a lot of symptoms in each of the remedies, but clinically what I have found useful, I'll be sharing those in my live session. So good afternoon, Dr. Sadhna, Dr. Bavankar, Apurva, Neta, Gopi, sorry, Razik, Samir, Rihanna, Palak, welcome. So those are the cases. A very interesting case. Last week only I cured. It was a simple case of recurrent cough. Yeah, Dr. Sangma, good afternoon. Recurrent cough, and there was a typical cough of that patient, and we prescribed first. I think I prescribed Coccus cacti. It was, the patient was better. Then we shifted to mephitis. The patient was better, but still not improving. Then on taking history and past history of skin separation in a 5-year-old child, we prescribed arsoraflavum, and that cured the case. So this is how, sometimes you find that don't always go on that symptom that when the best selected remedy fails to cure, give the XYZ remedy. Sometimes, if you have not asked the past history properly, there is suppression. You take into that account, and then you can change the remedy. The main important thing in this case was to understand that even in acute cases, if it's because of suppression in the past, a chronic remedy definitely cures the case. So case taking again is very important, and it is not the amount of time taken for the case, 1 hour, 2 hours, 3 hours. It is which symptom you have taken for interpretation, and which symptom basically defines the whole patient's personality. That is important, So amount of time, people tell me that we have done case taking of 2 hours, 3 hours, and that's why we have got so many symptoms. Always tell them, don't go on the time taken of case taking. What remedy prescribed depends upon the interpretation basically you take of the case. So interpretation of the case is very important. That case could be for 5 minutes, 10 minutes, 15 minutes, half an hour, depending upon your what you call understanding of that patient symptoms. Okay. So one of the questions, Dr. Almagi, welcome. Sore throat since 3 days, even can't drink water also. See, whenever the patient comes complaints of sore throat, and see, if the complaints are very much acute, you have to remember one thing, that only one symptom will not cure that. There are a lot of other remedies, where you find this symptom. And of course, if the patient, see, you have stated that the patient cannot drink. When he drinks water, what happens? That is the prescribing symptom, So, for example, if the patient complains that there is pain in the throat, now, whenever the pain is so much that drinking aggravates the complaints, or the patient cannot drink water, there's a difference between that. So, if the patient says that drinking aggravates the complaint, the simple remedy is cantharis. But the patient says even drinking causes pain, then where is the pain? The pain radiates from the throat to the cheek to the ear or anywhere in the on the face. Then that's important. You could think about few remedies. Those are very important. First is Moxol. Second is Phytoleka. Third is Hiparsal. Fourth is Causticum. And fifth, you must always think about Vithya also, depending on the symptomatology. Okay. Belladonna. Okay. Dr. Karthik, welcome. So this is basic. Otherwise, see, of course, the acute symptoms are very important to treat. Otherwise, if you can't treat acute, the patient says, how will the patient doctor treat the chronic complaints? So swallowing aggravation, if you take a generalized symptom, then you have a whole set of remedy which are very very important. As I told you, mercury Muxol is there, nitric acid is there. You can add leccan, then hipersulf is there, argentum metallicum is there, then ammonium carb is there, arsenic is there. Then you have different modalities, basically what drinking food, drinking water, taking food, liquid, solids. It's see, your case taking has to be such that then you have to zero down to a remedy from a big rubric to a smaller, so that you zero down to a particular remedy. Sometimes patient comes and says that the pain in the throat is so much, I even cannot speaking aggravates, even touch aggravates. Then the remedy changes, like we have kali iod, we have phytolacca, we have lacases, heparsal, spongia, fluoric acid, lots of remedies. So these basically are very very important symptom to zero down to the remedy. So you must basically take everything into account. Okay, welcome Dr. Jain. Yeah, welcome. Hello Dr. Babel. Irritating cough with sensation as something stuck in the throat and relieved by sputum is expelled. Simple, Dr. Sangma. You will get a lot of cases, with this symptom. And the first remedy that you should think about, I had a fantastic case where the patient used to say that the throat is so dry that I cough, that the mucus seems to stick and I cannot take it out. And every time I used to hug the throat, it's like a worm in the throat. That was a symptom which I cured with that the remedies. But now the patient comes and tell you there is something is stuck up, and when sputum is expelled out, the patient is relieved. Simple remedy, you must think about first remedy, and that is Calibicrom. Calibicrom, I hope you must have used that remedy, and that's a very very important remedy. The patient feels that when the mucus comes out, the patient feels better. So first remedy should be Calibicrom, second should be Naxomica, third should be again Muxol, fourth should be Phytolacca. But first remedy, you must think about Calibicrom. Okay. Skin complaint present since 5 years. I prescribed sulfur but failed. Can we go for sulfur directly? No, Dr. Samir, basically skin complaints for 5 years, that means that it is now become a chronic complaint. So whenever you want to prescribe sulfur, of course, if the symptom similarity is there, you can definitely prescribe sulfur. But do take the whole case that why 5 years and the patient has got no relief with the medicine. That is very important. In this case, it is not important that which remedy you prescribe. In this case, the importance is how has the patient evolved, why the skin complaints are there, and what are the prescribing symptoms in the patient personality and the drug. That is important. Okay. So your Rus video is available in your Insta post. It is Rustox, Dr. Tikvik. I don't know whether it's Rustox or not. Dry cough in girl, 12 years of age, expectoration yellow to white more now at morning. Her, this is less. No, it is not that. Someone said, if I have the case, a lot of people say that don't start the case with no sod, but if the symptom similarity is there, what Hahnemann says, if the symptom similarity is there, of course you can start with sulfur, so don't worry about that. Dr. Samir. Expectoration yellow to white now at morning. Her thirst is less, given pulsatilla but partial relief. Now see, whenever you find that the patient has expectoration, especially in the morning, okay, so especially that's morning, yeah, yellow to white. Now see, if the patient itself is getting cured, for whatever remedy, it has gone from yellow to white. Now the patient is improving. Of course, pulsatilla, if you prescribe one symptom, is very important that there is a bitter taste in the mouth. So bitter taste in the mouth, if it is there, then it is pulsatilla. If it has gone from yellow to white, then 3 remedies are very very important. The first remedy, of course, you have given pulsatilla. Second, you have to think about hipersulf. Third, bryonia, and fourth, cilicia. These are the 4 remedies you must think about. Right ear pain and something stuck in the throat. You must think about Phytolacca, Muxol, Calibicrom. Dr. Jain. Irritating cough with, yeah, we have finished that question. So yeah, it's a lot of question of cough. Of course, it's a season of cough. In cough, basically, if you want to see, differentiate into dry cough and wet cough, then say if it is dry cough, they see the modalities, and because of coughing, where there's pain in the throat, or how does the pain come, that is more important. Exfoliation of palms and soles in summer. Basically, if there is exfoliation of skin in summer, Only summer if there is no problem, there's no need to treat the patient. If it's only in summer, it comes and goes. Don't treat it. Don't suppress the sore if it is coming. If it is causing a problem to the patient, there's so much exfoliation, the patient has to continuously remove those scabs. There are cuts, there are cracks in the palms. Then you must think about the remedy. Okay. Okay, is this video later available on Instagram? Yes, I think, yeah, it is available, Dr. Vanik. It is available. And if there is exfoliation of skin, of course, natrium is there, petroleum is there, calcarea is there. But I don't treat that if it is psoriatic expression. Just it comes and goes. At the most, you can tell the patient to apply some moisturizer, some Vaseline, petroleum jelly. It goes out on its own. Sir, I have a patient who says she feels extremely hot, that she has to uncover herself to cool off while sleeping, and she is in a late 40s. She can't cover her feet, too has to keep it in open. Yeah, extremely hot. Now, see, if there are other no modalities, if there are others no modalities and the patient says the patient is extremely hot, even the patient comes and tells you that he has to uncover the feet when she's going to sleep. Now, simple. Whenever the patient comes to you, the patient is extremely hot. There are three four remedies which are very very important thing about. First, definitely comes sulfur, then comes fluoric acid, then comes what you call iodine, then comes kali sulf, then comes argentum nitricum, then comes calcarea sulf, then comes carbon sulf. These hot remedies are very very important, and those basically define the whole personality. Do ask about from what symptom, other symptom, to zero down to one remedy. Okay. Yeah, welcome Nemuddin. How to approach a case in knee joint pain? Cases, knee joint pain, of course, if you ask me, if there is a pain in knee joint, if the local symptoms are most pronounced, like the patient comes and tells you, sir, in the knee joint the pain is so severe I cannot get up, if I get up there is a crackling sound and I have to walk, or the knee joint pain is the lateral side, medial side, there is dryness of the knee joint, I feel as if I will fall down when I start walking. So if there are syphilitic symptom related only to knee, then you can take a syphilitic symptom and prescribe for knee complaints. If it's a psoriatic, it's a dull pain, gradual pain, age-related osteoarthritic or osteoporotic pain, then you have to take the whole history and definitely think about some acute remedies like guaiacum is there, like arenadadana is there, like these remedies acute, so that it could relieve the patient acutely, and then you can prescribe the other constitutional remedies to cure that case. Dr. Hadi, welcome. BP is normal. Yes, Dr. Sangma, the case, in this case, it is very important to understand that when you're prescribing in these type of complaints, only don't take that hot part, take other symptom prescribe, but these hot remedies are very very important to prescribe. So can we go further? And we have other cases waiting. If no are, yeah, you can ask some questions. There are some questions on Insta which I moved on. Knee pain, if you are very very keen to understand that, basically the knee pain, I had a case basically of a classical knee pain, and the patient had a classical symptom, Dr. Razik. There was, the patient used to tell me that it is like पानी पे के बुलबुले कैसे रहते, उस प्रकार का मुझे नी में हमेशा लगते रहता है. तो क्या करता है, मुझे नी को हाथ लगाना पड़ता है, टू जस्ट टच द नी एवरी टाइम. इज दैट बबलिंग सेंसेशन वाज देयर, एंड सरप्राइजिंगली I just prescribed, of course, I then added some of few symptoms. I prescribed Berberis vulgaris. Now, Berberis vulgaris is never thought in case of knee complaints, but that patient has a typical sensation of that bubbling sensation. I remember one more case where the patient says that the patient came and told me that there is the knees feel so stiff. It feels as if there's a bandage around, that somebody has put a tight bandage around the knees, and he has to jerk his leg or move the leg or massage the leg to relieve that sensation, and then she can walk. In that case, I used a simple remedy, silicia, and the silicia cured that case. So if there is a particular syphilitic symptom on the local part, then you have to take that symptom for prescription, and then go ahead in your case taking. Okay. Yeah, I told you, Dr. Salman, a patient feel extremely hot. So, of course, yeah, Dr. Vishaka, welcome. So, in this case, sir, how to approach case of irregular periods with vitals are normal and USG is normal. See, dysfunctional uterine bleeding, basically, if the patient is suffering from, it's definitely a hormonal problem, and If it is a hormonal problem, especially in young girls, then you have to find out why the hormones has been disturbed. Now, what happens in this case, I've seen in many cases that hormone disturbed in today's world, it is a competitive world. And the girl basically is trying to compete, and the father and the mother has a lot of expectation from the girl, and she cannot fulfill that expectation. She is very precocious. She cannot tell it to anybody, and then everything goes around and causes the first symptom of DUB. In the opposite is also true. The girl is very spoiled. She gets everything what she wants, and she cannot face the challenges of life in school, and then the period starts. Third thing is also there, the girl basically is very upset about something. Sometimes it's a sibling rivalry, or sometimes it is bullying from the school, or her best friend has left her, and that causes a very impact in the mind, and that also causes dysfunctional uterine bleeding. Okay, so there are a lot of other causes, but in this case it is important to understand that if it is a hormonal imbalance, you have to take the whole case and see why the hormone has got disturbed. Dr. Razik, it was given Berberis vulgaris 200. I repeated that dose once in a week for the first month, and once a month the second month, and then tapered it off. I think I repeated once after 3 months, and that was the case. Dr. Mukesh, welcome. And Dr. A patient of eczema, weeping type, I prescribed graphitis 30-200, and then I 1M. Some relief, not cure. Yeah, see, what happens in case of most of us when there is a weeping eczema, yeah, and of course, graphitis is so much taught in basically in our colleges that we basically start graphitis. But what happens that it has to be understood that whenever there's a weeping eczema, if it is all, then you have to see how is the discharge of the eczema. If the discharge is of course sticky and all, then you can basically think about graphitis. But see, there are a lot of other remedies where there is a weeping eczema, and graphitis did work because it contains that part in it, no? And then see whether it is there's a sensation of burning, sensation of crawling, and the sensation of itching or discharge basically at what time, at what part of the day. After eating something, the itching worse, the gets worse and all. These are various other modalities that you should think about in case of weeping eczema. If still you want some remedies, if graphitis has failed and you feel that your remedy is near to graphitis but not graphitis, then there are some remedies you must write down that I'll tell you. Think about miserinum, think about rustox, think about staphylos aureus, think about oleander. Oleander is also a very interesting remedy. Please go home and read that remedy. Homeopathic, Homeo Health. Yeah, welcome. Oleander is a very, very interesting remedy. If you have never tried oleander, do think about oleander, because I have got lots of results with oleander and it definitely works better. Don't only general eczema, but only weeping and dry and then prescribe remedies. Eczema has a lot of other things, lot of itching part, lot of discharge part. How's the discharge? It is echorious, it is blend, it is watery, it is sticky. How much sticky? Does it form scabs? How are the scabs? Scabs is easily to remove. How is the color of the scabs? In detail you go and you will get definitely good results. Okay. Dr. Vaishnav, welcome. Do suggest remedies known for RA, patient inflammation, swelling, ankles, and stain. Yeah, whatever remedy which I told you today in case of, arthritis. Now, whenever you get case of arthritis, it's an acute complaint. It is very, very important to relieve the acute complaints. If you're not able to relieve acute complaints, and the patient says that basically whenever I have acute complaints, I have to take a painkiller. Don't go into that. There are beautiful remedies in homeopathy which works very well. Write down the remedies. If there is swelling of the joint, pain of the joint, in acute pain, you have to think about those remedies. I'll combine the remedies both of small joints also and large joints also. Think about first bryonia, think about colchicum, think about Actea spicata, think about ledampal, and think about sulfur. These are the basic remedies which will give you good results. Apart from that, you can think about causticum, and another very rare remedy that Oleum jaccalis is a rare remedy that you think about. Oleum jaccalis is one, second is guaiacum, third is Gaultheria, and fourth remedy, which is again sometimes it gives result, sometimes it does not give result, that is Simesifuga, depending on the complaints. I have to be fast in answering because there are a lot of questions pending. I'll just take one on the YouTube. What would be the remedies for irregular periods and experience and verified by user? See, irregular menses. If you open the Mathematica, you find lots and lots of remedies. Whenever you have irregular menses, believe me, it is basically a hormonal imbalance. So it depends upon why the hormone has been imbalanced. So I basically don't use those acute remedies, like Sabina, Thalaspi, Trillium. No, it is basically either related to progesterone or estrogen problem. Now I had a case where the patient. I'll just discuss the case and then we'll go forward. Dr. Sama, to sum it up. I had a case where the patient basically had irregular periods, and the patient started developing that hirsutism, change in voice and all. All reports were normal, still the patient had DUB. In those cases, if you find that the patient has all the reports normal, but PCOD, there is no PCOD, there is no hormonal problem, there is no thyroid problem, her hormonal levels of estrogen, progesterone are more. In that case, I prescribed a single dose of testosterone 200, and how beautifully all the periods started coming normal, the voice changed, the attitude of the patient changed, which was basic towards the male dominance, the hirsutism started getting better, and a beautiful lady tried to come out from that prescription. So that's how basically you have to judge the case. It's all basically hormonal. It is not that always you use testosterone or progesterone or estrogen. If at all, you find that your remedy is right but still it is not working, then you could use these remedies like progesterone or estrogen as an intercurrent remedy to cure these DOBs. Okay, and these remedies also work very well in case of females suffering from other problems, like we have breast problems, we have vaginal problem, dryness of vagina, leukorrhea, where selected remedy fails and it is because of hormones. So these hormones you can use as intercurrent remedies. Of course I do it, that's my experience. I'll take one question for Instagram. Frequently decayed teeth. Please tell me recent silicia calculi for deontology. See, frequently decayed teeth. An interesting question. Just we had a case and it really worked very well. See, frequently decayed teeth. Now you have to see what is the age of the patient. Now we have some cases where children's and the teeth decay very easily, teeth decay very fast. Now, in broad sense, if you want to answer the question, 3-4 remedies that you should remember. First, think about fluoric acid, think about creosote, think about stephysagria, think about, of course, calcarea flow is definitely there, but these 4 or 5 remedies are very, very important. Then you can differentiate whether the tooth decays first, the root decays first, the gum decays first, the crown decays first, and you can, of course, go prescribe remedies and differentiate and zero down to a minimum. But the most important remedies, according to my experience, fluoric acid, creosote, stephysagria, thuja, calcarea floor are basic remedies that you should go home and read and differentiate from the Mathematica. Dr. Kadilar, welcome. Okay, Dr. Sangma, I hope you have got the answer. Next question, sir. I have many female patient complaints of only calf muscles, female of menopause and male of heart disease. Yeah, see, in menopause, basically the estrogen goes down and there is a hormonal imbalance. So definitely you get a lot of patients with lot of females say that there is a lot of cramps, lot of stiffness of the what do you call, calf muscles and all. In this case, it is not always to prescribe only for calf muscle, like prescribe Macphos, prescribe calcarea, prescribe stephysagria or Kalis. First, basically see whether the patient is fully hydrated. Patients, what do you call, that electrolytes are okay. So you can advise the patient to take coconut water or electrolytes. This should basically suffice to the patient. Same goes with the heart patient because of the blood flow and because of that. In this case, basically don't go symptomatic. Just first see whether it is basically a deficiency of electrolyte and then do that. Otherwise, if there is a menopause case and if there are other symptoms with this like flushes and irritability, dreams and mood swings and all, then you can make a generalized case taking and then prescribe for the whole case rather than only prescribing for muscles of this calf. Don't prescribe for that. Dr. Desai, welcome. Tuberculum versus bacillum thermomodalities. Please share your experience why bacillum is hot and why bacillum is hot and why tuberculum is chilly. That is because it is written in the Mathematica, so we prescribe, and just to give a oral view, just to give a broad view, when do I use those cases? See, tuberculum patient, basically, if there is a case where there is a recurrent cough and cold, a beautiful tubercular child, there's a history of tuberculosis in the family, and in these cases, basically, I give an intercurrent tuberculum. Of course, it is not always intercurrent. Sometimes, if there is a tubercular personality also, and if I find that the Constitution is tuberculum, I start with tuberculum also. In bacillinum, basically we find that cases where there's history of suppression of ringworm, case of history of bronchitis, case of history of lung infection, recurrent lung infection, or in case of ILDs and all, and those patients suffers from other problems, I prescribe bacillum. In these cases, this is how I differentiate in case. Of course, there are other differentiation which are in Mathematica, which I don't want to go in detail because I have already answered this question, I think in my YouTube, I think 2 or 3 weeks back. So you can go and check the YouTube video and you get the answer. Good afternoon, Dr. Prajapati. Yeah, thank you, Dr. Sangma. Patient had injury to neck, spine while farming. Okay, has paralytic sensation in left leg, has burning feet. Will while going to sleep, he has to bang his leg on floor or has to walk continuously. So injury to neck, spine while farming. Most important thing, how did the injury happen? Something hit, a blunt instrument was there, or a sharp cutting instrument was there, or that we say in Hindi fast lag gaya ho. There are other things also which you have to take into care of, or otherwise it's very easy. If you can prescribe all injury drugs, like you can think about Belispor, you can think about Ledampal, you can think about Staphysagar, you can think of Conium, you can think of Arnica. These are the remedies you should think about, but you have to have the cause. What was the cause? Blunt instrument, sharp cutting instrument, small weed that sticks sometimes. So there are a lot of other causes you must take into consideration. Arnica gave Arnica gave partial relief. Arnica definitely, if you see in any injury case, Arnica would get relief or partial relief because it is a very important remedy. But you go into detail of the case and then you get a better idea of what remedy to prescribe. Dr. Fatima, welcome. Had a fall too much. Patient says whole hair goes from root, which happens same. Hair fall too much. Patient says whole hair goes from root. What happens same continues in future? Yeah, so if there's a case of hair fall, first of all ask the age of the patient and ask why is the hair fall. If there's a patient who is taking who is a protein deficient patient, protein is lacking in the body, you can hair fall. If the patient has suffered from some acute exhausting disease like typhoid, like malaria, after that also you get health problem, then the remedy is different. Or health problem is because everything is normal, still the patient has hair fall because of the hereditary history in the family. So these questions you have to ask to the patient, and then you can arrive at a simillimum. Just for hair fall, I don't recommend you to go and prescribe Jaborendi or Arnica, because those are remedies which people prescribe, and I don't know whether it works or not, because I don't do that. A lot of people come to me and they have already taken that Jaborendi, mother tincture, and Arnica. I don't prescribe those because I don't. I always try to find out the cause why the hair fall is there. That's important for us. Hungry Divine. Yeah, welcome. So one of the questions is of corn. I think if you have joined me now in the YouTube live, corn, basically I have taken what do you call, so much in my other YouTubes, videos and all. If you see corn, we have described it very clearly, but still see left toe, if you still want something for corn and it is very painful, so we can take in this case some remedies which are very, very useful that you have to think about. First is, of course, in all cases you do think about antimicrobial because it is painful. And if you have asked to a child, try to describe the pain. In corn, the pain is important. How is the pain? It is horny corn, so pinching is there, pressing is there, pulsating is there, shooting pain is there. The remedy is different. Just painful corn, think about antimicrobial, think about sulfur, think about ranunculus bulbosus, think about nitric acid, think about what do you call, iodine also, and think about calcareous silicate also. 5-6 remedies. But it is to go further and describe the pain would be very very much good for the patient, and you can hit the simulum on the first instance. Silicia actually is also there when the corns are inflamed. That's also important. Okay, so some questions have scrolled up in, I think, YouTube and Insta both. You can ask the question again. Dr. Desai, I hope you basically whatever questions you ask, it is important to go still deeper so that you can basically make a sometime picture, location, sensation, modality, and concomitant. You have to have some chart. only by just asking corn, there are so many remedies, only by asking eczema, there are so many remedies. Then you have to start going beyond eczema and how it is, the modalities, the discharge. And just by knowing 3-4 symptoms of that particular symptom of that area also, no, syphilitic part, you can give wonderful results to your patients, And in today's world, the social media is so much important. There are a lot of programs also. You can just put 2-3 symptoms, but your symptoms have to be those symptoms who are prescribing totality. Don't take the common symptoms. Prescribing totality through 2 or 3 symptoms, 2 or 3 rubrics, you can get to about 3-4 remedies. Then by differentiating your mater medica, you can definitely prescribe those remedies. Okay. So there were a lot of new doctors who joined in today. I hope they also understood something which I wanted to share. But today the questions flow was very fast. I could not discuss anything, any of my cases, but I tried to answer most of the questions. So welcome to Dr. Shubhangi. She has joined a bit late. So I hope you get all the information about the YouTube. We do it for half an hour. So it's very important for everybody to join about 2 minutes before, so that we are prepared for the questions and I'm prepared for the answers. Every time, the questions are so sometimes difficult, I have to also think and answer, but to the best of my abilities, I try to answer all the questions. Any questions which I have not answered, you can write. It's already half an hour up. Yeah, anybody? Any questions, or we are through with this session today? Yeah, pain abdomen suddenly immediately after eating, getting hot or exertion, face of vomiting, grinding teeth during sleep, many fears, always thinking about the worst. See, whenever you get a patient, and important is that there is vomiting. And how is the vomiting? It is immediately after eating. So whenever anything touches the abdomen and the patient starts vomiting, this itself becomes a very important prescribing in a syphilitic symptoms. And if you see the mater medica, if the vomiting is very easy, aggravation, eating, you can say no, sudden immediately after pain in the abdomen. Okay, so the patient has pain in the fear of vomiting. Okay, so when the patient comes that there is pain in the abdomen, and the pain is basically after eating. So whenever the patient comes then complains that the pain is after eating itself, basically eating food is basically life. That is a physiological demand, and that is disturbed. That means the patient, that becomes a very, very important prescribing symptom. So make sure that you basically have your mater medica in hand, that you have to have some remedies that has that in that symptoms proving immediately after eating. That is why. And you can always take a symptom, then there are some remedies, if I'm not mistaken, if you can divide this, pain in the abdomen while eating, or pain in the abdomen on every attempt to eat. Again, a very, very important remedy. And the patient is absolutely pessimistic. Remedies, first remedy that you should think about is calcarea phos. First remedy, calcarea phos. Second remedy, staphylococcus aureus. Third remedy, viratramal. These remedies are very, very important. Then you have to differentiate, maybe in your case it is written that it is immediately after eating, and your patient is absolutely pessimistic. When you have a patient who's absolutely negative, so see, nobody is born negative. There has to be some cause for that. So if you say immediately after eating, and if you just give me some modalities like the thermals and all, we'll be able to just prescribe now only. So immediately after, the patient is very negative, you can think about few remedies which are very, very interesting. As I told you, calcarea phos. In fact, in calcarea phos, while eating, the patient start vomiting. That is important. In your case, think about graphitis, think about natramur, think about natrum carb, think about arsenic, think about, in fact, naxomic also. If you see the rubric pessimistic, naxomic is 2 marking in that rubric. So naxomic also sometimes becomes pessimistic because of failures in life. So graphitis, naxomic, and natramur, natrum carb, arsenic, whatever I can gather from my knowledge of mater medica now, those are the remedies you should think about. How to manage a case of fibroadenoma? Dr. Razik, very simple. Just take the whole case. Or the local symptom in the breast, if you find that the tumor is very hard, it is soft, it is duffy, the skin is reddish, it is bluish in color, then you can basically try to get the local symptom and prescribe locally. The patient is hot. Now, very good. So one more symptom we have got, that the patient is hot, the patient is pessimistic, and the patient basically has pain in the abdomen after eating. Now, if you have this modality, Dr. Alexander, think about 4 remedies. First is lacasis, second is thuja, third is nantramur, and fourth is sternum metallicum. Very, very interesting. Yeah, Dr. Alexander. I also have missed, again, conferences are there. In fact, in Hahnemann Jayanti, I'm going to Bombay for a seminar. So I started 2 years back, and I also never thought that people would like the way of teaching and all. That's why I'm a little bit busy. I'll get back as soon as possible. Vomiting at only at night after eating in child. See, whenever you have in children's, whenever you have in children's vomiting, especially at night. Now, don't just take that after eating at night. So you can have, what you call late night vomiting in children's. Then 3 4 remedies which I have used in my practice. First is ferrum metallicum, second is calcarea carp, third is china. I think fourth is lycopodium. Do take that about that. Yeah, Dr. I would definitely find a way. Yeah, so I hope today a lot of questions, and I tried to answer most of the questions. I hope you try to prescribe in your patients, and next time I will I will want somebody to tell me that it is basically good and the remedy has worked. Thank you for the Dr. Babel. Thank you for the case. Those cases basically are one-to-one acute type of cases where whatever the patient talks, I just write down and give the remedy. Those type of cases, and people enjoy it. So thank you so much. So until next time, meet you on next Saturday. Thank you so much for joining.